Mama Chiamaka, come here for a minute. Have you ever touched the top of a newborn baby's head and felt a soffing covered by bone? Some people say, be careful, the baby is not breathing well because the soft spot has gone inside. Others say, it's rising because something is wrong. But how many of us actually know what that soft spot is? Today, let me explain it in simple English. That soft place on a baby's head is called a fontanelle. Many people call it the soft spot. A baby is not born with one solid skull like an adult. Instead, the skull is made up of several bones with soft spaces between them. The biggest of these spaces is called the anterior fontanelle. It is the diamond-shaped soft spot you feel near the front of the baby's head. This fontanelle is formed where the two frontal bones and the two parietal bones meet. At birth, these bones have not yet fused together, so a soft membrane covers the space instead of bone. Now you may ask, why didn't God just make the skull one hard bone from birth? The answer is amazing. First, the soft spot helps the baby's head squeeze through the birth canal during delivery. If the skull were completely hard, childbirth would be much more difficult. Second, after birth, a baby's brain grows very quickly. The fontanelle gives the skull room to expand as the brain grows during the first months and years of life. Many people become frightened when they see the soft spot sink in. The truth is that a slightly sunken fontanelle can happen when a baby is dehydrated. For example, after severe diarrhea, repeated vomiting, or not getting enough fluids. It does not simply mean the baby is not breathing well. If the baby also has dry lips, cries without tears, is unusually sleepy, or is not feeding well, seek medical care immediately. Because dehydration in babies can become serious. What if the soft spot is bulging outward? A baby who is crying, coughing, or lying down may have a fontanelle that bulges briefly, and that can be normal. However, if the baby is calm and the fontanelle stays swollen or tense, especially with fever, repeated vomiting, seizures, extreme sleepiness, or poor feeding, it could mean pressure inside the skull has increased. That is an emergency and the baby should be taken to the hospital immediately. Another question parents ask is, when does the soft spot close? The anterior fontanelle usually closes between 9 and 18 months of age, although healthy babies can vary. So don't panic if it hasn't closed exactly at 1 year. Healthcare provider will monitor your baby's growth during routine checkups. So remember this, that soft spot is not a weakness, it is one of God's amazing designs. It allows the baby's head to pass safely during birth and gives the growing brain the space it needs to develop. The next time someone tells you that a baby's soft spot has gone in because the baby isn't breathing properly, you'll know the truth. If this explanation taught you something new, like, share, and follow for more simple medical lessons. I am still a student doctor. Stay safe.